Frisky's Fancy Feast food or whatever it's called. So she ate a whole bunch of food, which is good. We couldn't get a catheter in her, but it's not a problem. So I just gave her a lot of sub-Q fluids. And they work wonders. And if it's something you want to do at home, we can do that too. If you think you can. If not, you can bring her for sub-Q fluids if you think she needs them every now and then. Okay? So I'm giving you a copy of the radiology report, so at least you have it, so you have something of it. If you want the rest of her records, I can definitely do that too. Okay? So pretty much what this says, and I can show you the radiographs in the room again because we did 3 views. Okay? And she pretty much says that there's a cavitary mass in the right caudal lung lobe, so the back part of the lung lobe. Okay? Most consistent with primary pulmonary neoplasia. There's a small nodule she suspects could be a metastatic disease, but she can't prove it, so she's not sure. So we're kind of going to go 50-50 on that one, okay? She said it could be an artifact from summation, can't rule it out. Most likely the mass would be visible in ultrasound, and if we wanted to pursue something further, like we talked about, we could do the fine needle aspirate with Dr. Tina if she felt comfortable to send it out to see if this is what it is, okay? So as far as if we are going to go with the diagnosis of pulmonary neoplasia, so the lung cancer, then we just keep her comfortable. And she's comfortable now. She has, no nasal discharge. The eye discharge is something that she's had before.
From birth.
I think she was a little excited when she came in and a little stressed. She was a little tachycardic, so she had a high heart rate. But there was a whole bunch of stuff going on this morning, so I think she came in right within the rush. She had a slight arrhythmia. I can't hear it now. And it happens sometimes with cats. We get arrhythmias too sometimes, just when we're stressed.
I'm curious, how does a cat get lung cancer? Do you think it has anything to do with the litter we use? Because we use a litter that was no dust and everything, because they have that eye thing from the mother. So we've been using the same thing for years. Yeah. But somebody had mentioned that to me, so I was just wondering, how does a cat get lung cancer?
So as far as cancer goes, we know that it's an abnormal cell. So the cell ends up, cells go through the cell cycle, and as long as they're healthy, they get spit out into the circulation, okay? Cancer, so cells that are not healthy are supposed to be technically gobbled away by macrophages within the body, and then they are no longer. So unhealthy cells get taken away. Cancer cells do something different, which is why we don't like them, and they end up skipping that phase of being detected as abnormal, and they get pushed out into the body. So that's how it happens. Animals can get lung cancer and kidney cancer and liver cancer and bladder cancer, and a lot commonly in cats is lymphoma. They get lymphoma, and it can present mainly, the main thing I've seen here so far is GI lymphoma. They're vomiting, they have diarrhea, it's a waxing and waning effect, and we finally kind of either do the ultrasound or it's an old cat and we see, just elevations and certain things within the blood work, and we usually think of lymphoma. She has elevated calcium, which we talked about the other day, so it is indicative potentially lymphoma, and cats get that. It's just, it happens.
So moving forward,
one of those things we just noticed. We wouldn't have known.
Right.
We never would have known.
Or she just could have died in her sleep.
Yeah. Like when we would have thought, an old kitty cat.
Yeah.
Things happen. They just pass away.
Right. So moving forward, do I need to give her an appetite stimulant every day, or?
We don't have to as of yet. So I can, if you want, give you an appetite stimulant. It's called mirtazapine, and we actually have them. We compounded them so you don't have to quarter the pills or anything. And you would just give her 1 tablet every 72 hours, so every 3 days, and that would help. She ate today. With all the commotion, she ate.
It's
and
weird.
I don't know if it was just because we gave her some stinky food that we had. Instead of the RD or AD, we just had these little cans of the Fancy Feast that we gave her, and she ate it. She was in her own little area. There was no other cats, obviously, with her, so she didn't have to fight for food. So it may be something where at home we need to put her in her own area, put the food down, and wait for her to eat. That way she doesn't feel pressured to eat around other cats, okay? She drank, she used a litter box. So she was with normal cats.
So it's just a matter of her eating and living her life out and seeing what changes, and then I call you.
Yeah,
so
we just want to keep her comfortable.
If she keeps eating pretty normal, how much pain-free or quality of life do you think she could get?
At this point, I don't think she's in pain. I don't.
I mean, you think it'd be a month, or you think it could be a year? You have no idea?
It's funny. So I had a cat that had mammary cancer, and we took it out, and they said, I sent it to the lab, and they said probably about 6 months.
What kind of cancer?
Mammary cancer.
That's what I thought.
Yeah,
like breast?
Mm-hmm.
Yeah, okay.
It's been 2 years.
All right.
I don't know. She passed her expiration date.
Yeah.
You know, we could have her for another month. We could have her for another 6 months. We could have her for another year. Who knows how long this has, been there, this cavitary mass that we're assuming is neoplasia. And, who knows if it's progressive or fast. So has it been there since, I actually looked at her file. I got the paper file from 2012. We went and got it, and I looked at it with Dr. Dooley, and we had seen the primary presenting complaint was a gurgling noise in her lungs. Has it been there since then? I don't know.
Right.
And if it has, well, it's obviously not causing an issue. Could that have been the same thing? Maybe. It's possible. But, we don't have a lot of records on her from then, but from 2012 until now, she still looks and presents like a healthy cat.
I mean, that neoplasma, whatever it's called, how fast does that grow?
It depends. Sometimes it can just be almost like in a steady state, and sometimes there can be something that triggers it, and it starts to really take over. Yeah. We don't know.
So as of now, we're just making her comfortable. Yeah. It's like hospice.
Yeah. She's going to hang out with you. She's going to do her normal kitty things at home. And then if she starts to have respiratory distress, she stops eating, then we start adding things in to help her be more comfortable. Right. So, and it's just a process that we have to watch her and make sure, that we're doing the right thing for her.
Now, you talked about getting a second opinion on something.
Yeah, so if we wanted to actually see if it really is a cancer, then we would have Dr. Tina do a consult. So she's an internal medicine specialist. She comes here to our clinic. She's amazing. So she can come here and just do a consult with you and do a full physical exam on her and look at the radiographs, and she can just explain things to you, and you can have, another person explain it and all of that. She can do an ultrasound, and she can look at her lymph nodes, and she can look at her abdomen, and she can look at her chest. And if you wanted her to go ahead and take a sample of that mass and send it out, it's something she could do also. So she's more of the person that would tell you, is this spreading? Are we worried about metastatic disease? She could probably give you a better idea than what the radiographs can at this point. Yeah. And it's not something you have to decide today. Yes. Not at all. Right. Okay? We didn't give her anything today that would cause any abnormalities in tests further down the line. Okay? And we gave her a short-acting steroid, which will help her feel better, will help her eat, and is not going to cause any harm to her. Okay? So if you wanted to do it this week, next week, 3 months down the line, you could. And if you don't want to do it, you don't have to. Okay. It's not necessary. It's only necessary if you really, really need to have an answer. And some people don't. Right. And as long as we're happy, just keeping her happy, then I'm fine with that.
And she's not in pain?
Nope. Right. I don't think she's in any pain. She's breathing just fine. She's not open mouth breathing. She's not pale. She's not blue. She's not in respiratory distress. She's not laterally recumbent on her side, not moving. She's sitting in the cage, or she's laying on her back so I can pet her, and she's purring, and she's alert, and she's responsive. Okay. And that's good. Okay? All
right. Well, I guess that's really about it.
Yeah, it's one of those, unfortunately, it's one of these things that we deal with, and we can't do much about it.
No, you can't.
It's just, it's hard. And, maybe there could be chemotherapy options, and I'm more than happy to send you to the oncologist so they can work the case up too. But it just depends on how far you want to go.
Yeah. Okay. All right, we're going to stop. Thank you, doctor.